Hello, my name is Gillian. Thank you, AIT, for inviting me to the graduate seminar series. Hope some of you find it useful and enjoy. So my name is Gillian. I'm from Galway, and my current role is a dietitian. So I went to AIT in 2012. I did the Bachelor of Science in Health Science and Nutrition. And the course is 4 years long, and you have to do a combination of assignments, presentations, and exams, both written and practical. So you have to do lab practicals. And with that, the course was largely science-based, in addition to nutrition, public health, and health promotion. And I was also required then to do placement. So I went up to Donegal and went to Letterkenny General Hospital for 3 months, and here again an insight into hospital setting, what dietitians did, how the catering process worked, and then my course mate and I, we implemented the calorie counting and allergen legislation within the hospital. So overall, because it was 3 months, we were able to gain really solid, strong work experience. Which, and I know my other course mates have also said, it really stood to us in terms of applying then for future jobs and further courses. Yeah, so it made me eligible then to work in different nutrition related roles. So I then was able to be eligible to work with Ford BIA and UCD is a food dude researcher. And so I had to go around to different schools in the west of Ireland and gather research. I was also able to apply for different nutrition volunteer roles with nutrition related charities. And the main thing for me was that it made me eligible to apply for a master's in nutrition and dietetics in Chester, which has led me to my current role now as a Band 5 rotational dietitian in Liverpool at Aintree Hospital. And as a Band 5 rotational dietitian, you spend a certain amount of time in different acute areas. So far I've done gastroenterology and head and neck at the moment. I've also seen a lot of COVID, diabetic, orthopedic and cardiology patients. And going forward, I expect to also complete further rotations with surgery, renal, critical care and stroke patients. And as an acute dietitian, you complete your job in both a clinic and ward-based setting. And ultimately what I do is I look at patients' nutritional statuses and I assess whether they need further nutritional support, whether that's with nutritional supplement drinks or with tube feeding, known as enteral nutrition, or if patients have specific medical conditions such as, say, irritable or IBD, chronic kidney disease, diabetes, you give specific dietary advice tailored to those medical conditions. And as well, it's a really busy, varied role. You also are involved in student training. You work really closely with MDT workers, so the doctors, speech and language therapists. And you also give educational talks. So these could be related to cardiac rehab, gestational diabetes, and stroke. And you're also then involved in service development and doing audits and things like that to try and improve the service. So it is a very busy job, but you do get a lot of job satisfaction out of it, especially because in hospital, nutrition always does play a massive role in terms of patients' recovery and managing symptoms as well. In terms of the course I've done at AIT and my current role, as I said before, it was really a door to allow me then to go on and study for the desired career that I wanted. And on behalf of my other course mates as well, it also did the same for them. One of my friends is a home economics teacher, another one works for quite a big food industry company. And overall, the course, it was 4 years of hard work. It was a very busy course, but it was very well structured. The lectures are all really, really good, really supportive. And I think it all left us with a very strong work ethic, good time management skills. and again, a really good baseline of science and nutrition related subjects. So say, for example, when I went and did my master's, especially for the likes of the science-based modules, such as biochemistry, I always refer back to my AIT notes. It definitely did give a very good, strong baseline of the science and the nutrition related modules, which then made it easier in terms of going on to study and as well work in nutrition and science-based roles. In terms of advice for students, I've put these in capitals and feel quite strongly about them. And these are just from my own experience and from what I've learned. The first being less stress, more success, which I know is easier said than done. I know as a student you have a lot on, you're busy, but when you are less stressed, you do perform to a higher standard. And I know, as a student as well, you feel like you need to spend all your time studying and doing your assignments, but the stress then can add up. And especially sometimes I know people study really, really hard, and then on the day of, the exam or that, stress can get the better of them. So it's managing your stress levels, which I know is easier said than done, but do look at your stress levels, mind yourself, because the less stressed you are, the better you'll perform. And that leads into quality versus quantity then, which I've learned. So instead of spending days in, days out looking at your laptop, spending hours and hours and hours, and we all know that, you end up procrastinating, you go on your phone, you watch TV. Whereas if you give yourself a good solid 4 hours where you turn off your phone, you turn off the telly, still take regular breaks, you'll get far more work done to higher quality in less time. And again, in that time where you're not working, then you can rest, you can recuperate, because when you return, then you'll be able to get your work done just as fast and to a good level. The final one then might seem a bit silly, but it's definitely one I've learned. So I know a lot of students sometimes can just study extensively loads of different topics and areas, and you feel quite confident in them, you feel like you know them quite well on the day of the exam, or that you just see the buzzword of the topic and off you go, instead of actually reading the question and seeing what's been asked. So that's just a key tip I have, just from experience, just making sure that you're able to put all your hard work that you've done, onto paper and into your assignments, and that for your work to pay off, but at the same time also looking after yourself. And I've left my email there that for anyone who wants it to, whether it's to ask about dietetics or to ask more questions if it's about the course, or any questions at all, I'll be happy to help if I can. And that's it really. Thanks again to AIT for inviting me to the webinar. And if any questions, send them on. And thank you.